Stu, welcome. So grateful that you're here. Before we get started, I just want to hear a little bit about you and your background.
Yeah, awesome. So I am actually from Utah. Most of my life I grew up in northern Utah, lived in southern Utah for, I don't know, about 20-something years. I went to school to be a therapist. I got a master's in social work from Brigham Young University. I've been working with teens ever since. So
That's awesome. Tell me a little bit about Vive.
Vive kind of came about just from looking at families and their needs. I was asked by quite a few people, like, hey, you really should start something that's just here for our community in St. George. We have one of the higher suicide rates in the country consistently in Utah. So yeah, in St. George, we thought there's a need here. Let's provide some kind of more cutting edge treatment. I have a lot of years working with adolescents in treatment centers, but I wanted to do something that was a little faster, a little bit more, something that would more motivational for the client as well as the parent, and getting them home and with some skills and some tools and change, get them going in a different direction.
So that's wonderful. It seems like Vive is really data driven. You guys are actually paying attention to the needs, and when some things are just kind of blanketed over, like, okay, generally we'll do this to help treat, you know what I mean, these types of mental disabilities and things like that.
Mm.
But it seems like you were saying, like, you guys are cutting edge. You guys are basing things off of what actually works and listening to patients and their families and what their needs are.
I would say we are definitely focused on outcomes. Outcomes drive what we do, because we feel if we get good outcomes, like, everything else goes good. There's a quote we kind of go by: if you do good, good things happen. And just doing this for as long as I have, that was a super big focus, and is of Vive's, as far as you can do treatment, but if you're not really doing effective treatment, what are you doing? So we definitely data-driven, outcome-driven. We do cutting-edge things, and we have to be able to back that up. So, like, we do therapy with ketamine-assisted for trauma kids who've been pretty stuck. We were the first, as far as I know, the first adolescent psych hospital to do this. So we definitely wanted data to show, is this effective? And it's been super cool overall. It's been a super cool process.
That's awesome. What therapeutic models are used as far as like CBT and DBT, etc.?
Yeah, we really try to match the models, as I've looked at what we've been doing, to match the model to the client. So we do a lot of natural client-centered, which is really relationship, trying to build the client up. A lot of our clients that come to us are pretty broken. A lot of them don't have much hope. They haven't had much positive experiences over the last few months or years. So we really try to change that and match them with the therapy that would align with it. So, like, cognitive behavior therapy, a lot of our groups are dialectical behavior therapy. DBT is what it's called. It's really teaching them new skills, new ways of doing things, trying to instill a lot of hope with them. We use a lot of fast-acting EMDR. It's called ART, Accelerated Resolution Therapy. We find we get really good outcomes in a short process with clients who are ready for that kind of treatment.
How is treatment individualized for each team? You kind of talked about that, but maybe go through just what someone can expect from, you know what I mean, first coming into the doors, setting up an appointment, that type of thing.
So when a client first comes in, like I said, we do a pretty thorough assessment to try to really kind of see what are their needs. What are they struggling with? We talk with parents. We go to a pretty in-depth biopsychosocial. We've kind of started a new process where we call it our 5 Vives, where we're really focusing in 5 key areas of the client's life and looking at, are they getting needs met in those areas? And sometimes we've seen in the treatment world, we over-focus. So if a kid has social skill problems, that's all we focus on is social skills with them. And we find that often if we'll focus on the other Vives, so there's physical, emotional, social, spiritual, mental, and we find that if we focus sometimes on different ones that they're already doing pretty well, it can really help them struggle with the areas that they're struggling more in. So that's kind of our holistic approach, is we're trying to treat all the areas as well as doing a lot of work with the family in preparation if they're going home, to really help them and the parents feel confident that, hey, we know what we can do now and we have a different way of responding.
So that's cool. It seems like it's more harmony based and balance based.
Yes.
So that's super interesting as far as like, okay, socially, you know what I mean, it maybe at this point it does need to be a little bit, louder, you know what I mean, as far as like, and so it's like finding that harmony of because that's obviously when like the synergy happens and things like
Yeah. Yeah, definitely. And finding just the right little pieces that they may be missing. I often call it going fishing with clients, because sometimes they've just missed a few simple things, or the parents are maybe doing something over and over thinking, hey, this will get us something different. And if you could just adjust it a little bit, and then the outcomes become drastically different for them. So, yeah.
That's awesome. That's so cool. As far as like, what if, maybe this is I don't know if this is a common thing, but if it was a concern of the client not speaking, not giving you anything, you know what I mean? I'm sure there's different, it's hard to play pretend in that situation, you know what I mean? Because everyone's different and it's like, how you're gonna, navigate that. But is there any type of assurances, or, you know what I mean, like to put parents at ease as far as like, hey, like my kid's gonna be the worst to work with, you know what I mean? Like they're not gonna give you what you need. They might pretend, they might lie, you know what I mean? Those types of things. Oh, what would you say to that? I guess that
Yeah.
question.
How would I answer that one?
Yeah.
So one of my core values is we don't really give up on clients. We work with, sometimes I would say, the hardest of the hard, the kids who are probably the most sad and broken. I had a girl I worked with. She was with us for about 4 days. She didn't speak to anyone. She kind of would get aggressive and violent sometimes with our staff. She wouldn't eat. She just would sit in a room in the corner. And they were like, we're not sure we're going to be able to really help this girl. So I gave it a little bit of space and time. I tried talking to her once before, and she wasn't in a place at all ready for that. So then one day I went in and I sat down, and it was kind of the make or break time. Like she's not eating. We gotta get this client going. And I remember I sat down close enough but far enough away. So I was close enough to her that she felt some sort of connection, but far enough away that if she got really dysregulated, like I could get up and keep myself and her safe. And I just asked her a couple questions, and I remember asking her specifically, like, you seem really sad and you're really afraid of what's going on. And she kind of just, she hadn't looked up at me, and she looked up at me. Then she looked back down, so I knew, okay, there's some connection going on. I waited a little bit longer, and I was about to leave, and then she said, I want to go home after this. I said, well, I can't guarantee anything, but if you really do your work and things are different, then I think we could make that a possibility. I'll have to work really close with your parents, but let's see what we can do. And she turned from that point on. She was with us for about 4 more weeks. Ended up going home. She talked a lot more with her parents about things that were bothering her. So things like that happen pretty regular with us, where it's like a client's not making movement, has been kicked out of multiple centers, struggling at home, and has been for months and months, and we just don't know what to do, Stu. Those are our clients. Those are the people that we kind of set Vive up for, is kind of the ones that no one wants to work with, but we do. Those are the kids they need help as much as anyone. So,
Wow, I like just hearing that story made me emotional. You know what I mean? As far as like, this is like, yeah, the last ditch effort, and that the fact that you're saying that, hey, we're not gonna give up, and we have had experiences many times over, and we found success.
yeah.
Which is miraculous and amazing.
It is. It's hard work. Like, I'll have staff come to me and say, we got to get rid of this client, Stu. Like, they are just creating havoc. But those kids are usually the ones that they need the most love and support. But yeah, they haven't been getting it because they are super difficult to work with.
Yeah.
But yeah, that is Vive. That's kind of the essence of what we believe. It's like, we're here for everyone, but particularly those who aren't, no one's there for them. So
That's amazing. And you guys are equipped. You know what I mean? You
we
know
are.
how to do it. You have the right people. You have the right tools.
Yeah.
That's amazing. How are goals set and tracked at Vive?
So goals are really set with the client as much as we can. The more the client owns their goals, the better the outcomes typically are. We also involve parents heavily in that because sometimes clients only give you part of the story, and hearing the parent side of it, you get really a much more kind of holistic picture of what the needs are and what the goals need to be. And then just really working with the client on finding ways for them to achieve the goals through treatment planning. That's a big aspect of what we do, is taking the goals into their treatment and then following that with treatment team each week. Seeing, are we achieving these goals? Where are we still lacking with this client, or what's the client still kind of showing up with that maybe we aren't finding the right sort of interventions or giving the clients the right tools to kind of work through it.
Could you maybe give an example of the type of goals that you do set with the clients and the families? I mean, I'm sure it's like sometimes they're probably big and they just say the goal is just to get better, right? But maybe how you granulize that, how you like break it down for them. Is there a certain process, or can you give some examples of some type of the goals?
Yeah. In fact, I just had one yesterday with the client. Her and I have been working for a minute on kind of identifying her emotions. And then she came to me and said, I really need to figure out my depression. I have been avoiding depression for quite a while. And as we've been talking about my feelings, so it's kind of we kind of approached her as kind of a bigger umbrella. And now we're kind of fine tuning into what are the emotions she's avoiding. What are the feelings she's been either masking or trying to escape from? And it's really coming down to, she's hurt, she's angry about a few concepts that she's put on a smile, and now she's realizing that's not going to give her the outcome she wants. So that's kind of one goal in a sense that I've worked with her, is we started broad and now we're taking it down specific. But it's kind of a big question because there's so many different kind of clients and needs that we work with. But yeah, that's
awesome. So sometimes the goal might just be something bigger first, a big step. And then other times it's like, okay, well, you've successfully navigated some of the big steps. Let's get a little bit more specific.
Yeah. And sometimes the goal is very opposite. It's very simple. Like one client, their goal was to wake up every morning and just participate because they, in talking with them and the parents, they have been avoiding getting up and doing anything in life for months. And so that's all the goal was to get up and participate in the first group. And then we noticed that was the goal for them when they went home, was that was the entire home plan and agreement, was the client will get up by a certain time and just do something, and did extremely well at home. But that was it. That was what we worked on. And it was actually super cool that something that simple could change the entire outcome of this client's life. So
that's awesome. That's amazing. How often do teens meet with a therapist?
Yeah, that is really a case-by-case basis. So the minimum they do is a couple times a week for like a full individual session and a family session. But with our clientele, there's not really a set way. So sometimes therapists are meeting with the clients every day and coming up with simple goals for that day. Sometimes it's 3 or 4 times a week. Rarely is the once a week for an individual and once a week for family. We also do group multiple times a day, so the clients are seeing multiple therapists and getting multiple kind of different aspects or perspectives or way to look at things, which is pretty cool too.
What makes Vive's approach holistic? I mean, you've already basically said, you know what I mean, what kind of the approach is, but maybe let's just summarize it. You know what I mean? What makes it holistic at Vive?
Yeah, maybe a way I would say that slightly different is what makes Vive unique, or what makes us work. So one of our big core things in the beginning of Vive is I had worked in a lot of centers and we focused a lot on the therapy. What I noticed though is we were missing a lot of the medical. And so when we tie those two together, you get much more of a holistic approach. So most most of the time the research will back up that the best outcomes you get are when you involve both therapy and medication where it's needed. So Vive, that was a big piece for us, is merging those two worlds together and having them be very collaborative in their approach. Has been awesome. It's been definitely a learning process, even for all of us, me included in that. But that helps us, I find, treat more the holistic piece. Is you're helping the client with medication, you're helping the client with tools and skills, and then you're involving the family into kind of what needs to be different for the client at home, and how do we make those steps happen. So
That's awesome. So it's like really coming at it from every single angle.
yes, as many angles as you can. I find the more involvement you get from angles, the more people you get involved in change, usually the better your outcomes are.
That's awesome. You've kind of talked about this, but maybe there's a more succinct answer as how is progress measured during a stay?
Yeah. So we look at, when the client first comes in, we do a bunch of scales and assessments with them to see. So depression, anxiety, suicide would just be a few of the assessments that we do. About halfway through, or each time they shift in terms of our phases, we run them through the assessments we feel we really want to look at, or what we're working on with the client. And then sometimes we can run those every week if we need to. Sometimes we do it, like I said, at each phase. And then at the end, again, we reassess and look at those phases, those assessments, to see kind of where are we at, and are you ready to go home? So that's a key component to it. The other one we do is every week we're talking to treatment team about the clients, their goals, what things we're seeing, observing with them from all different aspects: medical, nursing, care staff, therapy, dietitian, all kind of collaborating and looking at that client as far as, are we achieving goals, or we review the goals that the client and the therapist and the family have set up to see if, are we meeting these, and are we feeling like we're going in the right direction.
That's awesome. When those assessment tests are done, is it just so people can have a clear picture of what to expect? Is that like someone actually talking one-on-one with the person? Is it a written question answer, type thing? How is that usually done?
Yeah, it's kind of a combination. So some clients you'll find don't read very well and have a hard time with that. And if those are identified, then we will go through the questions and do a lot more understanding. Some of our clients, being like the 12 to 13-year-olds, are a little on the younger age. Sometimes they just need understanding and explanation on what that question is. Our older ones, it's often like they already know, especially after going through it one time. So they'll usually be, I can just go through it pretty quick and let you know. Most of the time it is kind of a written assessment scale that they're filling out with the case manager. But yeah, the case managers are there with them and really walk them through that process.
Cool. How do you help teens who don't want therapy? I mean, you kind of talked about this with that story.
Yeah.
That girl just not talking to anybody, but any other things that you may have left out from that strategies?
Yeah. What I find is most teens, the way I would call therapy is just change. Most teens want change, particularly the ones we work with. It's got to be, it is the hardest time, in my opinion, in the history of mankind to be an adolescent. With that, on the flip end, it's also the hardest time to be a parent. And people want things to go better. I don't have a client yet that I've ever met with that said, yeah, I really like being miserable. This is super fun and what I want from my life. Most of the time they're scared, they're afraid, they're discouraged, they've tried things and they just haven't found anything that gives them the outcomes that they're wanting. So a lot of them developed we call it maladaptive coping skills. Things that don't work really, they work in the moment to help them maybe get relief or feel better. But long term, they realize this isn't really what I want. So knowing that, it's just finding kind of the right ingredient for that client, finding where their kind of struggles are at. And I've had clients say, I don't want therapy. I'm like, that's okay. Can we just call it a friendship, or can we call it a coaching opportunity? You tell me, but I do want to help you have a different outcome. Is that something you're open to? And almost always they turn with that. I can't think of a client that really hasn't turned saying, yeah, I do want things different. They might put up a wall for a while, but usually they almost always come back and say, I'm glad I put some effort in, because I was just scared, or I was just hurting and I didn't know how to handle it. So
That's cool. I feel like, yeah, just changing the language, you know what I mean? And kind of looking at the image a little differently. It's like, oh, yeah, you can just say, do you want change?
mm-hmm.
Do you want to get out of this funk? Do you want, and it's like, oh, that's therapy, but
Right.
You know what I mean? That's cool.
Even how I typically start my first meeting with the client is, that's the question, is what do you want different? What can I help you with that you want different in your life, or isn't working for you, that you want to be working? And most of the time, adolescents will give you that, especially if they feel like, okay, you're here for me and there's a connection. They often will just open up and start talking to you about it. Sometimes they don't believe they can get it, but what I find is, over time, they often get it. So,
how do you support LGBTQ or gender diverse youth?
Mm-hmm. Yeah, Vive, we've worked with quite a few kids who are part of the LGBTQ community, or maybe struggling with some gender identity. So we try to support it as much as we can, as far as if a client comes and says, hey, I want you to call me this name, then we really just, okay. Vive, we just try to look at it as more of, you're a person, you matter as much as anyone. We don't really put a ton of emphasis in gender. We aren't an affirming program, if I'm being real with you, where it's like everything, so they can sleep on the girls' unit if they're a biological male. We still separate that, but as far as everything else, we program co-ed. So most of the waking day is boys and girls are together, and if you identify as a boy, okay. If you identify as a girl, okay. Like, you're just part of the program. We're really looking at, are you managing your feelings and emotions and your behaviors in a way that's appropriate and healthy and safe? If you are, great. If you identify as this way or that way, as long as you're behaving safe and you're not hurting yourself or hurting others, all right. Like, great. If you're finding more happiness in life, that's our motto. We want you to love living life. If you truly love living your life and you're finding peace and happiness and success, awesome. We're going to support that.
That's cool, because it kind of takes away from so many people putting this hyper focus on maybe a symptom or something that's like, hey, like, that's not the problem. The problem is that you are an unhappy individual. The problem is that the path that you're going and the behavior you're going is going to cause you pain or pain to others. And it's like, let's just talk about that. Let's get
right.
That's really cool.
Let's just really work on getting you in a solid place before you make the gender the focus. It's like, that often isn't the focus of Vibe. Like, we don't put a ton of focus on how you identify as a person. We put our focus in on what's not working in your life that's creating you or other people pain or sorrow, and how do we work through that together. So
that's great. Do you use psychological or educational testing?
We do, especially where we feel we need it. So yes, we typically on that, we have outside professionals that come in and do the testing for us. They're contract workers, so it is not part of the Vive as far as the billing and everything. It is an extra cost for parents. But where we feel we need that little extra information, or we feel like something's been missed and we haven't been able to fully identify it, then we'll kind of work with the parents. We have our testers, I would say, are the best of the best. being in the industry as long as I've been in it, I feel like I've really kind of looked at who I think really produces really good psych testing. And then, but we're not even necessarily where we're open. So if a family says, hey, we really want this person tested by this person, or sometimes families have what they call education consultants or like family coaches that are working with them that have worked with another tester that they feel really would do a great job. Awesome. Let's get the outcomes we're wanting. That's what we're about.
That's cool. It's really collaborative.
Yeah. We are a fast process. So our average length of stay is about 30 days. That's one of Vive's kind of the process is we've merged a few treatment options together into kind of a fast-paced process. So it is fast. I found it's very hard to push a client faster than they're willing to go because they're not willing to go any faster. Sometimes like you as maybe the clinician or the parent feel pressure like, hey, this kid's progressing slowly. And so you're feeling pressure to like, we're not getting the outcome. But we really try to back that out of it, especially just trying to be like, the client needs to take it at their pace. Safety drives us. So like we're looking for the client feeling safe, the client making connection, and the client understanding. So what the question is, if you're pushing them too fast, you probably aren't getting very good outcomes because the client's not really connecting the pieces together. So slowing it down to where we can, or where I find is, yeah, clients often need to be pushed though too, but they need to be pushed appropriately. So if you're pushing them too fast, too hard, maybe in like trauma or things that have been super hard for them, they usually will start shutting down, and you can see that piece. So then it's just taking a step back with them and saying, all right, let's build from where we were at and let's get you ready to do this work. So
that's awesome. I think that's going to bring a lot of comfort to, I mean, because to everyone's family, that person, that child is the most important, you know? And so it's like, I think the worry is like, hey, he's already been or she's already been overlooked so much in school, you know what I mean? Or by peers or by whatever. And it's like, now we're just going to go to another place that's going to just say, hey, you just got to run and we're going to overlook you and we don't care, you know? But I think like, yeah, it's like it's like, hey, we are pushing them because everyone needs a coach, you know what I mean? It's like, that'd be so awesome if we all just had like on everything that we would do. But I think like, yeah, it is just, oh, okay, yeah, we're pushing you, but we're seeing that might be causing damage if they keep proceeding at that pace.
Yeah. Yeah, pushing them appropriately is I find super helpful because most of us need pushing or we need support and we need to be called out. So we really focus on like what are the goals or objectives we're trying to meet with this person and getting them aligned with that. If they align with it, then they usually are giving you full permission to say, let's push. So that piece is cool when you create that kind of connection and collaboration with the client on what they want to achieve. Most of them want to be pushed and they want support to get to the outcomes because they want the next step. A lot of them say, I want like this girl, I want to go home. She's just scared and she just wasn't sure she could find what she needed to get home. As soon as she gave me that, she let me push her in all sorts of directions, but I almost didn't even need to push her because she was saying, these are things I need. And then we just worked together to find out how do we make your goal happen for you. So yeah, things like that. Most of the clients I find are wanting to be pushed. They just need to know you're going to be with them as you're walking that journey together.
Can my child refuse to participate in groups?
They can. We get, especially so we have kind of 3 phases. We have Revive, which is our hospital. We have Vive, which is our inpatient. And then we have what we call Strive, which is more the residential aspect. Revive, if they really aren't wanting to be in group, then they can take breaks. That one we push, but we don't push super hard. Vive is like, you need to be in group. You need to show like you don't have to talk, but you do need to be in there. And then Strive, the expectation is you're engaged. Like you need to show that you have the ability to communicate your thoughts and feelings and that you're developing tools and skills. So when you leave, you're going to be successful and it's safe. And that we've known you've done your work. So that's kind of how we roadmap it. Again, every client's a little different. And every client requires their own element of intervention. But that's kind of the roadmap we use.
Let's talk about how much parents are included in the treatment planning.
Yeah, so parents, the more involved, the better for most families. So we really try to get the parents engaged in what are the goals, what are they looking for, and what's the client's goals, and seeing how much alignment they have. I have had sometimes it's super aligned, and sometimes it is very opposite. And so working with both sides to say how do we create connection, and it's usually a good indication of how much conflict they maybe have had is how much do they align on what needs to be different, and then working with them to either create resolution or come to a middle ground or a middle path around safety is kind of our big objective. If the client can be safe, then you can work through things. Even in the home setting, as long as everyone's showing safe behaviors and safe interactions, safe communication, then you can work through it. So
that's awesome. Do you feel like it's an educational problem most of the time? Like it's just that there's not enough information either from the parents or from the client, you know what I mean, about even about one another.
Yeah. So sometimes it is communication is a big component of it, helping them figure out how do we communicate differently. Sometimes there's a lot of kind of undealt with emotion, or you could even term it trauma. So helping the family work through the emotional side of it. So like I had a client whose dad was just super angry about kind of how the client had, kind of the way the client was living. Dad had dreams and hopes that this kid would be something, that the client was very different from the dad's dreams and hopes. So there was it was definitely communication, but it was almost an emotional process. They needed to learn how to feel emotions and feel safe and ability to connect with their own feelings, but connect with each other's feelings too, without judgment, without trying to force change. It took a minute for them to figure that out, but as soon as they figured that piece out, it was super fast, the treatment that they're like, it was almost like an emotional journey that they went on that created the connection that they needed. So yes, it can be a number of facets in it, but yeah, communication's a big one. Emotional kind of awareness and intelligence is another huge component to family change and connection. Parents being able to not overreact, or clients overreact to parents' kind of emotional or verbal statements at times.
Do you teach coping skills that last beyond discharge?
That is the key we find to coping skills. So if we're just teaching coping skills for them to use at Vive, I would say we failed the client. Like, what's the point if it's just for us? Like, Vive is set up. There was a gentleman that once said treatment needs to generalize for home. If it doesn't generalize for home, it's not really very, like, what are we doing? And that's one of the beauties of a shorter, kind of a faster pace process, is clients are really still generalizing everything to where they were just at. In most cases, we do get kids from all aspects and facets of the treatment world. Some come directly from home, some come from treatment centers, some come from hospitals. And so you get clients at kind of every phase of it. Sometimes one of my therapists says, sometimes we're the first treatment, sometimes we're the next treatment, and sometimes we're the last out-of-home treatment, which is cool. I mean, that's what I'm saying. There isn't one way with us or our clients, but we believe in that. So coping skills need to generalize to home. If they don't, then I don't feel we've done our job. And helping the clients understand, how do I apply this at home, is often super effective for them because, again, every client I would say wants things to be better, and helping them find what that looks like and how if they did this here and applied it to home, now things could be much different. It's cool when those lights click on and they're like, this makes so much sense.
It's awesome. That's great. Can I visit my child? And if so, how often?
Yeah. So the answer is yes. And our process is very fast. So typically they can visit their client we try to ask for a week of kind of opportunity for the client to kind of have some space, the parents to have some space, and really to create what we need different. Absolutely, the parents can come and visit them. We usually try to have a week space between when they first arrive and admit to when the parents are actually face to face with them. But even then, it's kind of on a case by case basis, and what the therapist is really seeing in the moment with the family, what the treatment team feels. But yeah, as far as visits go, it happens quite quickly, and we find it's kind of an essential piece. Like, we want the family to be doing the work. We want them to create connection, and we don't want to create too much space. At the same time, there still needs to be a little bit of space to figure out what can we do to be different rather than put you back together and it go back to the way it was just a week before. So,
Are family therapy sessions included?
family therapy sessions are a pretty vital piece to Vive. Like I said, if the more people you can get engaged in the treatment, particularly the parents with the client and them working through their issues, the better your success is going to be for the whole family at home. Often we find parents need to know how to do things different too. This isn't just focusing on your kid. It's also parents. Most parents really want to know, how can I be different? What can I do for my kid to really help get a better outcome with them? Those parents, the engagement, the more engaged a parent is, usually the better the outcome is, almost without fail.
How does Vive support parents emotionally?
So with parents, we are pretty involved. One of another core values of us is we want to make sure we're at least communicating, if not over communicating with parents. We want them to be involved. It's more stressful on parents, I find, than most of the time than on the client, because the parents aren't there with them. They're not seeing all this everyday kind of nuances that go on. So they're kind of stuck with their own way of thinking and their own thoughts. So getting them involved in and definitely communicating with them. So they get communication from the nurses regularly, from the medical providers regularly, from the therapists regularly, from the case managers. The dietitian works with them. So I've had a few parents say, you're like my fifth person I've talked to in the last 2 days, Stu. And I'm like, well, awesome. Yeah, this is a lot of communication. So then we try to work with them, like, okay, we can slow it down a little bit. I'll definitely let the team know, but we just want you engaged as much as we can in this process, because the more you're engaged and involved and understand it, the better our outcomes are going to be. So
That's fantastic, because I think a lot of times I mean, if it was my kid in there, you know what I mean? It's like, I would love to be the one to say, hey, like, I'm okay now. You know what I mean? Like, thank you for communicating all this to me. You know what I mean? Like, that's so great. Like, what an instant relief. Do you coordinate with school counselors or RAP teams?
yes, we again, us ultimate success is the client doing well at home. So the better the client does, the more we can be like, that was a successful process for them. So we definitely work with counselors at home. We obviously have to have releases signed in place by the parents for us to coordinate with them, but we work with them if we've noticed things that they might need to add into like IEPs or help the client in the school setting, we coordinate with them. We talk with their counselors or their psychiatrists at home for medication, kind of why are we doing this, if they need that information. We definitely want to be collaborative where we can on them leaving as well as them coming in. The more information we have that we feel like, hey, this is relevant and good information, or these are things that didn't work for the client at home, then that's that much more of a opportunity for us to find success quicker for the family and for the adolescent.
That's awesome. So they had information coming from before and giving the information after to help
Yeah.
everyone have success with them. How often do you do multidisciplinary teams meet?
So we meet twice a week as far as a treatment team. We meet every morning for what we call treatment huddle, just to kind of go over little snapshots, and if a client really struggled the day before, if there's interventions we need to put in place, or how do we support that client to have a better day that day. But as far as the treatment team goes, yeah, we meet twice a week. We cover every kid at least once a week in their family as far as our team approach. So as we talked about, medical team, the nursing department, the case managers, the care staff and program, and the therapists all meet together and dietitian to go over goals and successes or challenges that we're going through with that kid.
That's so awesome. I feel like that's like such a comfort. You know what I mean? Like it's like, yeah, we're at all angles.
Right.
Nothing's being overlooked.
Yeah.
What do discharge summaries include?
So discharge summaries will include kind of all the medical history that they've gone over, medications that they've been on, dosages. As far as the therapist aspect, it'll cover kind of goals that they worked on and achieved, successes that they had. If we've noticed any specific challenges that they went through, we try to include those in there. And then it will kind of give a roadmap to what we feel would be help the client continue to be successful at home, and what our recommendations are.
So I think there's a common scenario where the parents feel guilty about, I mean, it could be a different angle of like, oh man, I'm not good enough, that now someone else has to go and help. I'm not a good enough parent. I failed as a parent. Or that they didn't notice, that they didn't take it seriously, or whatever it was. How do you guys help with, the parents?
With that, one aspect is a lot of parents, they're kind of parenting from their island, is the way I might describe it. Is they're kind of on their parenting island, and they don't often get to see many other islands and how people parent. So normalizing it for parents, helping them realize you're human like all of us, and even giving them some examples of other parents usually really helps calm them and be like, okay, so Stuart, you're saying I'm not that maybe messed up, or I didn't really totally screw my kid up on this case. And it's like, yeah, no. In fact, the feeling guilt is often a good sign that you care, that you're there for your kid. Yeah. Like I said, most of the families we work with, sorry, I'm not sure why I'm getting emotional now. I did so good. Yeah, most parents love their kids, and they just want something. They want their kid to be happy. They want their kid to be safe. So helping them kind of work through, hey, we get it, but let's just make it different. There's hope. This isn't like something negative. This is something really positive. It's meant to be a beautiful aspect for you and your kid. And we're here for you. So helping the parent work through guilt and realizing that's possibly a really good sign that you as a parent feel like, oh man, I need to do better. It's like, awesome. Let's take that motivation and help you do better. Let's not take it as a negative. Let's take it as a positive. So connecting parents, with just maybe some new insight and some new ways of looking at maybe the ways they have been looking at it, and realizing, like I said, this is the hardest time in the history of mankind to be a parent. Like, we have things you have to navigate that there isn't really a great understanding or clarity on how do I navigate. When do I give my kid a phone? When do I let my kid be on social media? I mean, those are not clear-cut answers that parents have to answer, that no parent in the history up to that point has had to answer. And then kids are exposed to more things than they've ever been exposed to, that they're kind of not super good often for them to be exposed to. So just helping them navigate and realizing, hey, let's play the long game. We'll get you there. This isn't like, let's not just look at where things are at currently, but where we want it to go and how can we help you get there, and let's do it. So
I love that. The follow-up question to that is, maybe the understanding and the misconception, because this, I mean, personally, I've had people that I grew up with in high school and stuff that died by suicide, and um, and what's interesting is I also think that there's a misconception that you can be doing all the right things. A person could be living a healthy lifestyle, they could have a good family life, they could have love, they could be eating correctly, and they still could have that that problem. You know what I mean? That whatever they want to change, you know what I mean, that illness, that sickness, they're still sick. And to understand that's nothing necessarily that they did or that they should feel responsible for, but this is sometimes people are sick and that they need help. Do you have anything to say on that, or maybe like understanding like that's a, like you're saying like, hey, there's a common misconception of what mental health, like the causes of it, that's always something to blame specifically on.
Yeah.
You know what I mean? And I don't know, maybe I'm asking that question wrong, maybe I understand it wrong, but is there?
Yeah, it's a great question. For one, my heart goes out to like any parent who's lost a loved one, or any family member or friend who's lost somebody they care to suicide. Suicide is one thing that's 100% preventable if the right pieces are in place. But it's like you said, like it can come on in a matter of, I don't know, a one event. We had a girl who was with us, super happy, doing super well, and she broke up with her boyfriend, and it took her down a roller coaster of being this like straight A student, doing pretty much everything right, to really being super close to ending her life. And those cases sometimes aren't as lucky, where the kids, that one event can change the family or people loved them, the entire outcome. So it's really a lot about working on staying as connected as you can with your kids.
Is Vibe too early of a solution at any point? Like, does it have to be the last ditch effort?
Yeah, and a lot of families look at psychiatric hospitals as kind of like, my kid's really messed up. Like, we still kind of have a pretty bad rap as far as a treatment. Like, you got to be crazy, if you will, to go to a psych hospital. That's so far from the truth. You come and experience the clients we work with, and these are kids I would see in my neighborhood. These are my own kind of kids. Like, they actually have so much goodness in them, but they often, like I said, there's so much pressure on adolescents, and there's so much weight to like navigate this world that's super hard to navigate. And the stresses, the worries can really kind of pile up super fast. So yeah, I think Vive is a great piece, especially if you're just like, hey, like, can we just get our kid assessed? We're kind of like, our kid's starting to talk about suicide, or we're really starting to feel disconnected. Doesn't mean you have to come to Vive. It could just mean doing something different, but finding that piece, finding a connection with your kid that's maybe a little different, or finding other people. The more people you can get involved in our kids' lives in healthy ways, like I said, the outcomes are always better.
Would you ever not recommend Vive? You know what I mean? Or is it like, hey, yeah, like is there a point where there, and then in the evaluation that you think that, hey, this isn't the right fit? You know what I mean? Is that ever a thing?
There are kids who maybe have, I don't know, like made a mistake. Maybe they smoked weed on the weekend for the first time. I don't know if they need to come to Vive. At the same time, though, you never know. Like, it'd be horrible to not do that, like get the support that we need, but it is sometimes overkill. But how do you gauge that? I don't know. I really truly don't have a great answer. Like, well, my kid smoked weed. Well, maybe they're smoking weed because they're heading down a really dark path and they're trying to create resolution. So looking for more than one sign is often, but sometimes nowadays, sometimes you only get one sign, or you don't get any signs that my kid is really struggling. They were great in school. They were on the I don't know, on the club, in all the clubs, or on the sports teams and doing everything right, but sometimes that pressure. So I do find checking in with your kid more regularly, and not in terms of a parent or in terms of like trying to correct them or to tell them what they need to be different, but just truly trying to understand what are you going through? Like, what are the pressures you're feeling? What are some challenges you're going through? And as your parent, I'm here for you. And let's work together through this. If you can create that kind of connection and synergy around, we're on the same team and we're really here to support each other, your outcomes typically are going to be super good. But kids don't want to let their parents down as a whole. And parents don't want to let their kids down. So sometimes we put on we're looking really good in the name of like looking good. And sometimes that's not very good. Sometimes what really needs is just the connection that, hey, we're going to make mistakes. We're going to feel guilt. We're going to screw up. We're going to do something dumb. And it's okay. Like, you have to be able to make mistakes to learn. If we take that away from you, then you aren't learning, you aren't growing. And so, yeah, just kind of keeping that in mind too. Like, okay, like looking at, it's interesting because sometimes I'll hear parents ask me, like, to this kid, my kid is really messed up. And I meet with the kid, I'm like, they're actually okay. Yeah, they've got a few things they've got to work on. But again, sometimes parents are only seeing it from like their perspective, and they haven't seen, like, I've worked with a lot of kids over a lot of years, and most kids are just trying. They're just out doing the best they can, and they just need a little bit, sometimes just a little bit of tools. They need just to believe someone believes in them and from outside the home and is there for them, and you can turn a lot around with them. So
That's awesome. So, Stu, thank you for doing this.
maybe that.
And if people want to find out more or have questions, is there a place they can go, like a website? Can they talk with somebody?
Yes. Lots of resources you can go through. For Vive itself, it's just www.vivetreatment.com. There's help centers, there's suicide hotlines, there's school counselors, there's a lot of therapists out there that want to help and are in the helping industry because their hearts are there. But even if you don't want to go see a professional, see somebody that you trust, particularly a trusted adult, because I find they'll usually give you a little bit more life perspective than what you often get from an adolescent perspective or a friend perspective. But even a friend, I mean, if that's who you feel like you need to connect to or feel the safest, connect with them, and get support, because it's out there. There's always someone there for you if you're just willing to look.